All right, good day everyone. Today we'll be having our assessment together with our patient right now. This assessment is called spinal cord injury pressure ulcer scale. So the purpose of this assessment is it helps us assess the risk for pressure ulcers among SCI patients engaged in rehabilitations. So what are or is the area of the assessment? So it is for the general health of our patient, and for the administration of this assessment, we only need to have paper, and we also need to have a pen or pencil. Then, who are the people that can be assessed with this kind of assessment? So those patients who has SCI or spinal cord injury can only be the one who will have this kind of assessment. So what are the key descriptions for this assessment is that SCI patients are assessed on 7 dimensions. Most items are dichotomously scored for 0 if absent and 1 to 2 if it is present. So 4 items are rated on a 3-point scale based on the criteria described on the SCI-PUS or the spinal cord injury pressure ulcer scale. So the 7 dimensions of this assessment is that we have the level of activity. The second is the level of the mobility, severity of SCI. If it is complete SCI, autonomic dysreflexia, or severe spasticity. Then we also have the urine incontinence or constantly moist. Then we have the pre-existing conditions like the age, tobacco, if the patient is having pulmonary disease and all those kind of stuff. Then next is the residence. If the patient is in a nursing home or in a rehab or hospital setting. Then next is the nutrition for our patient. So yes, without further ado, let's start. Hello, ma'am. Good day. My name is Dave, and I am your physical therapist today. May I know your name, ma'am?
Maggie.
Maggie. So your age, ma'am?
24.
Okay. So let's start, ma'am, with your with the assessment. So first is kanang i-assess. What do you want, ma'am? Do you prefer English or Cebuano?
English.
English. Okay, so the patient prefers English. So, ma'am, the first assessment, ma'am, is we will assess your level of activity. So, since the patient is SCI, we can assume that the patient is in a wheelchair. So, I'm going to put or check the wheelchair here. Then next is the the mobility of the patient. So, since the patient is in wheelchair, so ma'am, are you able to roam around or you are just in your wheelchair, ma'am?
Wheelchair.
Okay, so since she just stays in her wheelchair, so and cannot really roam around, so we will check in her mobility with limited mobilization. So next, so the patient has complete SCI. So it's not because the patient can still move. So it's no. Then for urine incontinence, ma'am, do you hold your pee or?
Yes.
Yes. Okay. So we'll check yes. Then for autonomic dysreflexia or severe spasticity, we can also observe here and that there is a severe spasticity. And because the patient is hypertensive due to the hyperflexia, autonomic dysreflexia, we can say that the patient is positive for this assessment. So we'll put check. Next is age. So what is your age again, ma'am?
24.
24. So we will put check mark. Then, ma'am, do you smoke, ma'am?
No.
No, so never. Then for the pulmonary disease, does the patient, do you have any ailments, ma'am, in your lungs or?
No.
None. Okay. Then for cardiac disease, we can ask the patient if your EKG are abnormal or no. So put check mark for no. Then ma'am, do you have diabetes?
No.
No. Then for renal disease, ma'am, do you have any? Renal disease?
Renal?
Yeah, renal.
Yes.
Okay, yes. So we'll put one check mark for the renal. Then since the patient is oriented and she can answer our questions with reason and yes, so we will be putting check mark on the no side in the impaired cognitive function. So no. Then is the patient is in nursing home or hospital? So since the patient is in a rehab center, so we are going to put check mark yes. Then for the albumin level, we recheck it based on the laboratory test that we have. So since it is written there that it is no, so we'll put check mark in the no side. Then for hematocrit of the patient, it's negative, so we are going to put check mark on the no side. So, ma'am, thank you for your participation, ma'am. Yes. All right, so we are going to total the score of the patient. So the patient got a total score of 7. So the legend of this is that if it's low, so 0 to 2, it's low. Then moderate is 3 to 5. Then high is 6 to 8. And 9 to 25 is very high. So since the patient scores 7, so she belongs to the high, she has a high chance to have a pressure ulcer. So that's it. Hello ma'am, good day. So again, my name is Dave and I am your physical therapist intern. And today's exercise, we will be doing just range of motion exercises. Is it okay with you, ma'am?
Yes.
Sige, ma'am. So first, ma'am, we will be starting first with a shoulder flexion. So shoulder flexion, shoulder flexion, shoulder extension, shoulder flexion, shoulder extension. Then we'll have abduction, adduction, abduction, adduction. Then we will have supination of the arms, pronation, supination, pronation. Then we will have elbow flexing. So flexion, extension, elbow flexion, extension. Then we will have our wrist flexion. So wrist flexion, wrist extension, wrist hyper extension, wrist flexion, wrist extension, wrist hyperflexion. Then we will have with our phalanges, adduction, abduction, adduction, abduction, adduction. Then all the fingers, abduction, adduction, abduction, adduction. Fingers flexion, extension, hyperextension. Again, flexion, extension, hyperflexion. Then, alright, so the next passive range of motion that we will be doing is in her lower extremities. So first, we will be starting in kanang hip flexion sa patient. So, what we'll be doing is that we will grab the calf of the patient. Then our right hand will stabilize at the posterior or in the popliteal fossa of the patient, so that the patient will feel comfortable and it will just be smooth motion. Then after that, we are pulling the calf of the patient towards our body. Then we will be doing we'll be shifting my body weight towards the patient. So just like forward and backward, the shifting of body weight. So flexion, then extension. Flexion, extension. So while we are doing this kind of exercise, we are facing at the or looking at the face of the patient, so that we can see any signs of discomfort or irritation or pain. So by doing this, we are exercising the hip extensors and flexors of the patient's hip. So yes. Alright. Alright, so the next passive range of motion that we will be doing is hip abduction. So we are going to pull the lower limb of the patient towards or out away from the body. So still the same, we are going to grab the calf of the patient, then stabilize in the knee, then we are going to abduct the hips of the patient, abduct, then abduct, abduct, then adduct, abduct, then adduct. Alright. Alright, the next passive range of motion that we will be doing in her lower extremity is circumduction. So we are going to just superior to the calcaneus of the patient. Then we are going to stabilize or hold at the tendon of the calf of the patient. So the next exercise is passive range of motion, circumduction. So it's going to be like this. Yeah. So we will not allow the patient to bend her knee. So while we are doing this kind of motion. Alright. So the next exercise that we will be doing is internal rotation and external rotation. So we can do it like this. Still the same. We can hold the back or the calcaneus of the patient superior to the calcaneus or in the Achilles tendon of the patient. Then give support in her lower leg. Then after that, we are going to internal rotation, external rotation, internal rotation, then external rotation. Ma'am, do you feel any discomfort?
No.
Alright, so we can do it like this. Alright, so the next motion is internal rotation and external rotation, passive range of motion. So we can hold it here. Then we can hold also just posterior, a little bit superior to the patella of the patient or the tendon of the quads of the patient. So we are going to internally rotate it, internally rotate, then externally rotate, internally rotate, externally rotate. Then while doing this kind of motion, this passive range of motion, still the same, we are going to look at the face of the patient because we are trying to look any kind of signs of discomfort or irritation of the motion that we are doing to the patient. Okay, so that's it for the passive range of motion for both upper X and lower extremities.